We'll move on to issue 4, behavioral health treatment.
So, sure. So first, for an overview, as noted in the agenda, Medi-Cal managed care plans have been providing this service since September 2014. Since that time, we've had about 5,900 new beneficiaries receiving BHT services through their managed care plans. We did begin the transition in February of the coverage of this service, transitioning from regional center to managed care plans for what we think is about 13,000 Medi-Cal beneficiaries. So far, about 5,000 have transitioned. The transition was scheduled for 6 months. We may extend that at the end just to make sure we are holding people out from transitioning if there are issues with getting in contact with them. So we want to make sure we have enough time to complete that and make sure everyone's had the information that they need. 92% of the transition beneficiaries have remained with their same provider. So the plans have really done an excellent job of getting in contact with the providers and being able to get into an arrangement with them. In terms of the question about the timeliness to get the comprehensive diagnostic evaluation, so we at this time haven't seen specific wait lists at the plans. We do continue to look at this. So we did get some information this week to look at particular issues, and so our team continues to do that. We do monitor this on a regular basis. Both we just have regular data collection on a monthly basis where we collect how many assessments are happening, how long is it taking to get those, et cetera. In addition, we do look at the plan and county-specific grievance information, the call center information, state fair hearings, IMRs, and I know some of that information was in the agenda about what's been happening with that. So certainly if we see issues arise, we work with the plans to deal with them, but hopefully, those are fewer and far between, and right now we're not seeing a major issue, but certainly always if there is an issue for individual people, we encourage folks to reach out to us so we can deal and help with that.
And your interpretation of the high continuity of care in terms of the 90-some-odd% that stayed as a result of them being comfortable with their provider, or are they limited in terms of their opportunities to change?
They're not limited in the opportunities to change. It's really, the assumption is people want to stay with their same provider, and so the plans make that effort, but if someone wants to change providers, that's absolutely possible.
And they can do that at any time, or
Yes.
are there windows of opportunity?
No, they can do that at any time.
Excellent. Senator Monty, anything? LAO? Finance? Okay, we'll open up for public comment. 1 minute each, please. First witness.
Linda Way with Western Center on Law and Poverty. We do have grave concerns regarding delays in accessing BHT services. Our legal aid advocates report that there are 56 families waiting for a comprehensive diagnostic evaluation in San Mateo County alone, and they have filed 9 grievances with DMHC. Unfortunately, DMHC is closing many of these cases because their expert has opined that the child has not had a detrimental impact from the time lag, despite research to the contrary. DMHC has closed a case where a child has been waiting since February for an evaluation and still has not received an evaluation or an appointment for one. We believe this is a statewide issue, as the clinical director of behavioral health in Inland Empire Health Plan has reported in March meeting that there is a 6-month waiting list for a comprehensive diagnostic evaluation with over 400 children on that wait list. DMHC recently released its timely access report, and the mental health provider data was very limited, with only about 17% meeting the target sample size. We are concerned that children with autism are not getting needed services in a timely manner, and that the transition from regional center may put an additional stress on a limited provider network and obscure the limited data that the department has provided.
Kristen Jacobson with Autism Deserves Equal Coverage. We share the concerns that the Western Center expressed, and we, in the last 24 hours, conducted a survey of Medi-Cal recipients. I sent the preliminary results to Michelle this morning, but she was probably already here. But in 24 hours, we got over 76 families who filled out the survey, talking about their difficulty in accessing care. First off, 38% of the families were not even aware of the benefit existing through Medi-Cal. So that's a big problem just to start with if almost 40% aren't aware. In terms of trying to get a CDE, a comprehensive evaluation, only 20% who tried were able to get it through Medi-Cal, 27% got it through the regional center, 17% through private insurance, and 33% are still waiting. And that's mostly people with primary Medi-Cal. If they have secondary, 48% are still waiting if they have primary Medi-Cal versus only 12% if Medi-Cal is their secondary, and so they can go through their insurance plan. In terms of the average wait, only 9% have gotten the CDE within the 15-day time frame that is statutory, either statutorily or contractually required. 63% it's been more than 6 months or they are still waiting. And of the kids that are still waiting for their comprehensive diagnostic evaluation, 9% are getting services and 91% are getting no services. And we have, the DMHC did put out emergency regulations, as did CDI, about the irreparable harm by delaying treatment. If you look for behavioral health treatment, once you get your diagnostic evaluation, only 19% who've requested it have been able to get it through Medi-Cal, 29% through the regional center, and 52% are still waiting. 6% got it within 15 days, and 87% have had to wait 3 months or longer. So these are really significant issues. I think one problem is the way that DHCS told us at a stakeholder meeting that they are calculating availability. They have calculated the networks by adding up all 3 layers, so the 3,000 qualified providers, and it got a total of 36,000 providers, which includes the frontline technicians. And then they applied a 15-to-1 case ratio on that. But the 15-to-1 case ratio only applies to the 3,000 supervisors. The BHT frontline people can only handle 1 case, so or maybe 2 cases, so you can't use those same ratios. Our main request is that DHCS actually take the responsibility to track the wait list. It's a huge barrier to put it on us as families and advocates to try to calculate it. We, I think, are providing ample evidence that there are problems, and then we would ask that DHCS actually actively track waiting lists at all 3 stages. Thank you very much.
Thank you. Next witness, I'm going to ask everybody to limit their testimony to 1 minute. The committee would appreciate that.
Kelly Hardy with Children Now, also representing the rest of the Children's Health Coalition, CDF California, the Children's Partnership, United Ways of California, PICO California, California Coverage and Health Initiatives. Would echo the previous comments around the concern about the discrepancy between the department saying that there are no wait lists that they're aware of, and yet also these stories that we're hearing. There's 2 stories I'd like to bring very quickly from Sacramento County. There's one family who transitioned from regional center to Medi-Cal on February 1st, lost services, and is now on a wait list because the provider didn't meet the qualifications. And another boy who was recognized to be on the spectrum at some point in his 20th month and won't get services until after he turns 4. That kind of delay is, you can't bring that back, and that kid is going to be irreparably impacted. Not to say that he can't do great things later in life, but that's an impact you can't get back. Thank you.
Thank you. Melissa Cortez-Roth on behalf of the Center for Autism and Related Disorders. CARD is one of the largest providers of behavioral health treatment here in the state. Our concern is with how the department is determining network adequacy. Right now, they're sending forms to the providers. We're being asked to basically fill out a roster for each of the MCPs of all of our qualified autism service providers, professional and paraprofessionals. And then that roster is how they're determining network adequacy. This is a huge administrative burden on the providers, and the forms themselves don't take into account capacity or availability. A better metric would be to look at whether or not there are waiting lists, and we'd like to see the department take another look at how they're determining network adequacy and shift that burden onto the MCPs and away from the providers. Thank you.
Hi, my name is Michelle Hyde, and I'm a board-certified behavior analyst. I'm a service provider with the California Consortium for Behavior Analysis, and our goal is really to provide quality services to the Medi-Cal beneficiaries in a timely manner, and we've really struggled with lack of communication from DHCS and the MCPs. We've had a difficult stakeholder process, particularly through the webinars where questions are not answered, and we're not given adequate information to serve patients through the Medi-Cal program. There's also differences in information coming from DDS, regional centers, DHCS, and MCPs as to even who is going to transition and who's impacted by the transition. That we also echo the comments on the inaccurate network capacity calculations. It's just inaccurate how they're calculating it. We've shared that with them, and we haven't had any follow-up. This is all leading to gaps in services for clients or clients not receiving necessary services, as was already shared. And we have a lot of stories about clients who were receiving good services, good quality services through the regional center system who are now not receiving those services. And those gaps are, really troublesome. And if we as providers can't navigate this process and can't get communication when we need it and information, I really don't know how parents are dealing with this. If their children are not getting services and they're home having a lot of difficulties, I can't imagine how they're even able to, to figure out who to call and how to get their problem solved. Where at the regional center system, they had a service coordinator that they could pick up the phone and they could call. And even in that challenging system, there was more hands-on care. This is just very challenging, so we'd appreciate any support. Thank you.
Thank you. Next witness, please. 1 minute.
My name is Marla Saltzman. I'm also a behavior analyst speaking on behalf of the California Consortium for Behavior Analysis. I echo Michelle's comments, particularly the previous concern regarding network capacity and the way the calculation includes the direct care staff that grossly overestimates the number of providers. In addition, I have a concern regarding network adequacy with regard to the rates of the Medi-Cal MCPs. Many behavioral health providers are unable to contract with MCPs due to the Medi-Cal MCP rates. They're on average approximately 20% lower than the regional center rates were for the same service. And then finally, I echo the comment regarding families' difficulty accessing information, and the families that are currently receiving services and are transitioning are looking oftentimes to us as the providers to answer their questions about the transition process, and it's difficult for us to answer the parent questions, and we would welcome additional communication to from DHCS or with DHCS outside of the webinars where it's very difficult to have our questions answered and in turn be able to help families through this process. Thank you.
Hi, my name is Ella Sargent, and I am a behavioral health provider here in Sacramento. I'm also a board-certified behavior analyst. I'm really going to echo what the two previous members said, but basically in terms of, as a provider, the different billing requirements and service codes across managed care providers has been challenging. In addition, we would really appreciate increased communication and advance notice of managed care requirements for ABA providers so that we can share those with our clients. And the other main challenge has just been the disconnect in terms of expectations for the transition process between the different funding sources from the regional centers to the managed care plans. Thank you.
Hello, my name is Jacqueline Ganley. I'm also a board-certified behavior analyst practicing in Los Angeles County. And I will just repeat that many families are finding this transition very difficult. And as service providers, we're finding it challenging as well with the poor communication. We recommend increased and consistent communication for all stakeholders involved. Thank you.
Thank you. For those who talked about the network adequacy and some of the other issues, if you have your testimony in writing, the committee would welcome that, because other than the issue raised in the agenda with regard to DMHC grievances, the committee was not aware of some of the issues that you've raised. So that's problematic for us because we weren't aware ahead of time. So if you have testimony in writing, please share it as soon as possible. Given that we weren't able to agendize and raise some of these issues ahead of time, could you address the network adequacy issue and some of the other points that were raised?
So I am not the expert on this, and so those issues haven't been raised to me. They've certainly, I'm sure, been raised to my team, so I'll have to go back and circle with them, but we can follow up certainly with the staff on all
Please
that.
do, and then we'll figure out Sure. How, given kind of where we are in the agenda process, we can hear the issues. But some of the organizations and associations that spoke, please make sure that you communicate with the committee so we're able to track those issues and follow up with the department. That would be helpful ahead of time as opposed to just presenting them in committee. So the departments have the appropriate people here so we can kind of get to the bottom of the issue. Let's move on to issue number 5, full scope expansion for undocked children.
Alrighty, so as I think we all know, we're getting pretty close to the fact that the budget has funded the full scope expansion of Medi-Cal to all children under the age of 19, regardless of immigration status. The largest part of the enrollment is the kids who are currently enrolled in limited scope. And so we'll see that coverage transition currently scheduled for May 16th, but it will be retroactive to May 1st. And then after that date, certainly anyone new who's applying will just automatically be in full scope coverage. We did mail out in April the outreach letters to the children in the limited scope coverage, so they knew that this change was coming. With respect to the target date, we expect we're on target. I know your favorite topic is Cal HERES. But we are on target for the release 16.4 on May 16th. The final go, no-go decision is on the 12th. So we'll know by the end of that day if there's an issue. But at this point, we haven't heard any issues. We are expecting that it will be a go, and we'll be on track.
Thank you. Senator Monty.
Well, first, I applaud the department and proponents of this. It's obviously a huge step forward in building the foundation of healthcare in the state of California. Children don't come into this world mindful of a different status that gives them different access to healthcare, and it'll benefit all of our communities as well as our budget. So I just applaud that. I know that we're aware that Kaiser's been particularly supportive before this law of supporting health care for undocumented children, but I think there's been some question raised about whether those children would continue to have care through their Kaiser providers or would be able to pursue Medi-Cal coverage through other providers. And any comment you might offer on that would be appreciated.
Sure, absolutely. So there's no direct way for us to transition those kids. They're not known to Medi-Cal today, but certainly they could be enrolling in limited scope beforehand, although, at this point, it's almost to the place where it's full scope. And then certainly there are counties where we have direct contracts with Kaiser, where those children their families can choose to enroll them in that. And Kaiser does have subcontracts with plans in many of our counties, and so they will have that ability to make that choice once they're enrolled on the Medi-Cal side.
Thank you. And then just a final question. Is there any reassurance in the outreach that a family whose children are enrolled, that there's no adverse immigration consequence for the parents?
Yes, so that's standard in our messaging generally, but we did emphasize that in the outreach letter upon recommendation from stakeholders to really make that clear that none of this information would be used for anything other than their eligibility for health care.
Great, thank you very much.
Thank you. LAO, Finance, public comment.
Beth Capel on behalf of Health Access California. We were among the many organizations that were delighted that the governor supported the effort to cover all children through Medi-Cal. However, we're here before you today because we are disappointed that the department continues to fail to ease the transition of the 60 to 70,000 children who have received coverage through Kaiser. Let me back up a step. To the best of our knowledge, there are about 250,000 to 300,000 undocumented children in the income range for Medi-Cal in California. About 120,000 of them are in restricted scope Medi-Cal, that is emergency-only Medi-Cal. The department has worked to transition those children seamlessly to full scope coverage. The next largest population is the 60 to 70,000 children who are covered by Kaiser, have been covered by Kaiser for more than 15 years as part of their charity care and community benefit. No law required them to do it. We don't say very nice things about Kaiser very often, but on this one, they did a good thing for a long time. But since we have begun raising with this with the department in July, we have had the same answer you just heard, which is families can simply drop their coverage and apply for Medi-Cal. Time and again, this subcommittee has heard of other transitions where the department has made very considerable efforts to assure that people's care and coverage is not disrupted. We have sponsored SB 997, which the members of the subcommittee are familiar with, to facilitate that transition. We are disappointed that after wasting months when they could have been assisting these children in transitioning, today we get the same answer that we have gotten since July, that those children can simply apply in most counties, aside from Sacramento and San Diego and one or two others. When a family applies, it is not at all obvious how to sign up for Kaiser. I have looked at the websites of numerous of the plans that Kaiser is a subcontractor for. I defy a family. I can't figure it out. I can't imagine how a family could figure out how to sign their child up for Kaiser. So we look forward, we were meeting again with the department next week to discuss this. We are hopeful that we can work something out that will not require a change in statute, but if it does, given the timing, given that the transition is happening in May, we would be hopeful that we might be able to sort something out in the budget process. As a final point, again, very much to their credit, Kaiser is continuing coverage for these children as they go through the transition. And that actually further complicates the normal process of transition in Medi-Cal managed care because, of course, they show up as having other coverage, and Medi-Cal is, as always, the payer of last resort. Thank you.
I appreciate your testimony and your frustration with the department, but I just want to be clear in terms of the ultimate goal. The ultimate goal is transitioning to coverage, seamless transition, but I would assume it's also to empower the parents to have choice.
Absolutely,
We
ma'am.
tip our hat to the wonderful philanthropy Kaiser has exhibited. However, for me, that doesn't trump parental choice.
And as 997 reflects, and as all of our efforts reflect, families should be informed of their choices. The irony of the current situation is because when they apply to Medi-Cal, they, as best we understand it, and this is, as you know better than I, a very complicated area of law, when families apply, because they have other coverage, they will not go, in most instances, through the normal healthcare options process and be offered that choice.
Where they can choose.
And so one of the important things that 997 and any trailer bill might do is to inform those families that they have choice. We will look forward to working with the administration on this over the next few weeks.
Yes, go. There you go.
Don't want me to talk. No, so I just wanted to clarify, at least, and certainly we can follow up with Ms. Capel, the Kaiser coverage that they have now, it actually does not reflect as other healthcare coverage. So it's not in that same situation where they would be prevented from enrolling into managed care. I'll follow up and make sure that's the case, but I know we had provided that information to your staff before, and so I'll double check on that.
She's going to follow up. That means not now, Ms. Capel. Let me move on to the next witnesses. Thank you. But I'm glad that issue came up, and so we do have the department on record in committing to follow up. And I know you'll let me know if they don't. Next witness.
Linda Way with Western Center on Law and Poverty. We do appreciate all the department's effort in meeting the May 16 timeline. It will be a momentous occasion when all children, regardless of immigration status, can have access to Medi-Cal. We also think that continuity of care is important and look forward to working with the department on this.
Thank you. Next witness.
Christina Romero, Planned Parenthood Affiliates of California. Planned Parenthood has had a long-standing position supporting health care for all, regardless of immigration status, and we appreciate the administration's efforts in this and support the item.
Thank you. Next witness.
Kimberly Chen with the California Pan-Ethnic Health Network. Want to echo the comments of the previous speakers. Very happy to see the expansion of Medi-Cal to undocumented children and hope to see the smooth transition of the Kaiser kids. Thank you.
Thank you. Next witness.
Janice Canallen, on behalf of the Children's Health Coverage Coalition, I want to echo the comments of our previous speakers, and also we look forward to the department on the smooth transition of the Kaiser kids. But mostly we just really want to applaud the efforts of the department to begin this program on time. Thank you.
Thank you. Next witness.
Kelly Hardy with Children Now. We're just so thrilled and appreciate the department's efforts, and hooray, May 16th.
Here, here. Next witness.
Hi, Dan Chick with HealthNet. I want to thank the sponsor of 997. We have been working with them on the Kaiser transition provision, and I think we've made some headway in some areas of concern to us. But we do remain concerned about this question of when healthcare options choice actually triggers, when does it occur. We believe that at some point it's beneficial to the families to make that affirmative choice as to which plan they want to select. They may have a plan where there are other family members within the family that are with a different plan, and for geographic reasons, for other reasons, they may want to make an affirmative selection with a different plan. So we'll monitor the process, and we thank you for keeping us involved. Thank you.
Thank you. Next witness.
Good afternoon. Mary Adair from the County Behavioral Health Directors Association. We want to thank the administration for including county specialty mental health funding in this proposal. We would urge the Budget Committee to retain those funds. This will allow equal access for all children in the Medi-Cal program to access those more specialized services. Thank you.
Thank you. Next witness.
Thank you, Madam Chair. Teresa Stark with Kaiser Permanente. Not to belabor the conversation about the children that we have in the child health program now, but I did want to say we are working very closely with the department. There are conversations going on a weekly, if not daily basis to ensure that administratively, to the extent we can remove barriers and ensure that these children know how to find us if they choose us, and choice is very important to us. So we are in regular conversation. We have a communications plan in the works so that we can alert these kids that they now have this eligibility, how to sign up for Medi-Cal, that they can choose us if they wish, and how to do that. And so we really want to smooth that transition as much as possible for our children. And there is an issue that they do show up as having other health coverage, and so we are working with the department very closely now so that that doesn't become a barrier and they can transition in. So
thank you.
And available to the committee if you have any further questions.
Thank you. Next witness.
Madam Chair, members, Nick Luizos with California Association of Health Plans. Just simply wanted to state that other members in our trade association have echoed the implementation concerns that were raised by the gentleman from HealthNet. Thank you.
Thank you, Madam Chair and members. Kathy Sunderling with the County Welfare Directors Association. On behalf of the counties and the eligibility workers we employ to help make this transition, we're really excited about it getting going. And we're working now, just to let you know, to finalize a grant from a foundation that we'll be using to develop some statewide training and also some regional training for our workers, as well as to include local CBOs that could be good partners for us in ensuring the word is spread. So we're really excited about that. We'll be glad to keep the committee apprised. We are partnering with the HCS to ensure that we're getting the word out and that it's correct. So thank you.
Thank you. Next witness.
Terry Thomas on behalf of the California Association of Public Hospitals and Health Systems. We are grateful and support the expansion to children and just look forward to the day when we can include all the adults as well.
Thank you. Next witness.
Eduardo Martinez, California Medical Association. In support of this proposal, I want to thank the administration for taking this on.
Thank you. Final witness.
Gary Passmore, Congress of California Seniors. I just want to hope and express the hope that you will be there and I will be here in the not too distant future discussing coverage for older Californians who are undocumented.
Thank you so much, sir. On this item, we will hold it open. Moving on to item number 6, the 1115 waiver, Medi-Cal 2020 resources.
Thank you. So as we discussed in the last hearing, we are moving forward with the implementation of the waiver. So this request is for the resources for us to actually be able to do the implementation and the ongoing work. So we are requesting both 5-year and 2-year limited term funding that's equivalent to 31 positions in several areas related to the 4 waiver programs that we talked about last time, as well as 5-year limited term funding for the various contractual services we need for the evaluations and assessments. Happy to answer any questions.
Thank you. No questions from the senator. LAO, Finance, public comment.
Pam Ma from Health Access in support of this VCP.
Gary Passmore, Congress of California Seniors. I'm honored to be a member of the Stakeholder Advisory Committee overseeing the 1115 waiver. And instead of my usual asking for money for services, I urge you to fund the adequate staff of the Department of Healthcare Services to oversee this program.
Thank you. Next witness, please.
Yes, Terry Thomas on behalf of the California Association of Public Hospitals and Health Systems. We strongly support this request by the department. This waiver for public hospitals is really groundbreaking. We're embarking on some really important initiatives, and we think it's really important for the department to have the staff to support our work. Thank you.
Megan Loper on behalf of the District Hospital Leadership Forum. We too are in strong support. The district hospitals are really looking forward to their opportunity to participate specifically in the PRIME program and have really appreciated the work that the department's done and urge you to support their staff request.
Linda Way with Western Center on Law and Poverty. We also support this proposal, particularly around the dental transformation and the whole person care.
Jennifer Tannehill, representing the California Dental Hygienists Association. CDHA fully supports the additional positions for the Medi-Cal Dental Services Division, and especially those focused on prevention and hygiene. And bringing this expertise to DentaCal is long overdue, and it'll really benefit both patients and providers. Thank you.
Children's Partnership and strong support of the budget change proposal here, especially the whole person care and the dental transformation initiative. Thank you very much.
Thank you very much. I'll entertain a motion to approve the budget change proposal.
So moved.
Thank you. Call the roll, please.
Monning?
Aye.
Mitchell?
Aye.
Thank you.
You're welcome. Let's move on to issue number 7, waiver personal care services and FLSA.
Sure. So as noted in the agenda, and I know you've talked about this with DSS, starting February 1st, the state will be paying for overtime for both IHSS and the waiver personal care services. DHCS is responsible for the waiver personal care services program, so that's what I'll be talking about. So similar to DSS, we have developed an exception for the limitations on overtime for participants enrolled in the waivers before the month of February. And so those exemptions relate to if the caregiver is living in the home, regardless of whether they're related to the participant, if they've had an established relationship for more than 2 years, or also if there are participants who, when working with our nurse case managers, are unable to find additional providers that are appropriate for them, and that could be for various reasons, language issues or other special circumstances. We did develop a process for the participants and their providers to request the exemption. We estimated that based on the available data of the 1,800 waiver personal care services participants, that around 440 would fall into one of these categories. We notified the participants by mail in January and again in May on their options on the exemptions. We also had our nurse care managers call all 440 to, again, tell them about the exemptions and discuss their options. Again, we did that following the first mailing and did that again this week. So far, we've had 160 participants request an exemption. We also have begun to engage stakeholders on an exemption process on a case-by-case basis for those who joined the program February 1st or later. As also noted in the agenda, we did send out a notification to participants about the violations for the overtime restrictions, and that those would not be automated starting in May, but would rather, the automation would not occur until likely September because of the additional time needed to program the information systems to trigger automatic violations. So again, those looking to be scheduled to go into effect in September. So prior to that, we will be monitoring the timesheets for any egregious issues and could issue manual violations if that occurs. In terms of how we messaged that piece, we did notify both stakeholders as well as, again, the providers and the participants themselves about that change last week, 2 weeks ago. I can't remember my dates now. And then again, our nurse care managers are calling the WPCS participants to inform them and their providers of the change. So really doing a lot of hands-on with both trying to get via mail, email, and phone calls to the participants. In terms of the exemption process itself, yes, as I mentioned, we did send out letters. We also provided them the form that's needed to request the exemption. As I mentioned, 160 have decided to request an exemption so far, so that process is already in place for May 1st for those who have requested the exemption, and certainly if more come in, those will continue to be in place.
Senator Monning.
Thank you. Just, you said you made personal contacts with the 440 and 160 replied. Is there ongoing outreach to the roughly 280 who didn't yet respond or request the exemption?
So we did make calls again this week to again check with folks. It is possible that people were able to obtain additional providers, that our nurse care managers worked with them on that, so they may not need an exemption, but we will continue to make sure that folks are aware of that, and if needed, share additional information with them.
Thank you.
Sure.
And do you have a sense that, or what is your sense as to how people are understanding the new policy?
I'm not sure I am the best person to give you that answer. Certainly our team that works with the nurse care managers, are the ones on the ground talking to folks. I think, we've tried to explain it as clearly. That's why we did both the mailings and the phone calls. But, certainly can understand these things can be complicated. And so, to the degree there are suggestions for us on how we better communicate that, we certainly are happy to do that.
Thank you. LAO, Finance. Public comment.
Deborah Doctor, Disability Rights California. Been following this issue very, very closely, and we're happy that there is an exception policy. We have a little bit different view of the process that has been underway. The department sent out a letter January 25th or 29th telling recipients that there would be an exception policy, but didn't tell them until last week how they could actually apply for it. So 3 months went by with no information, and although I'm sure the department's intent was that every consumer involved was contacted, I'm in touch with several of the waiver participants. One of them told me week before last his case manager had no idea what he was talking about when he asked about an exception. That has since been brought to the attention of the appropriate people at the department. But these are people who have extraordinarily high needs that are beyond that can be met by the IHSS program. There's a small number of them. It was disturbing to us that with that small number, the small universe, that there wasn't the kind of information provided. And I know we're sort of at a she said impasse here. I talked to people directly, and this is what they're telling me, and we know that the letter didn't go out. And my concern is on communication. Last Tuesday, a letter went out to these consumers telling them the exception. On Wednesday, there was a release from the department saying that their violations grace period was going to be extended until the 1st of September. I scrambled to get that word out. Thursday, I heard that something else had happened, that maybe that was getting walked back, and I asked the question, is there or is there not an extension on this grace period? And I was not given a plain answer to that very plain question. So I still, now all I was told is, well, what you just heard, that the violations may or may not be going into effect. But this has been a very difficult process for a very vulnerable assortment of consumers and providers, and it's been disturbing to us as their advocates to watch this odd communication. Thank you.